So, good morning, everybody, and to the frontline supervisors, or I wasn't supervisors, essential workers and everyone out there, thank you for what you're doing to keep us moving. So, and please continue to do the right stuff out there, the people that are staying home. It's working, but sadly, we did not have anyone pass away, which is good news, but we had 3 deaths at a private nursing home earlier this month that had been reported to the state, but for some reason never got reported to the county Department of Health. So our death goes up to 76. It was at 73, it's at 76 now. Out of these people, one who passed away had the virus stands at 76, and then there was a person in their 60s and a person in their 80s with multiple health conditions. So I do want to say to them families, sorry for your loss. My condolences and prayers go out to you, as it has gone out to the 73 other families. This happened back in early May. We just found out about it yesterday, and we're trying to work through the logistics of for the reason we didn't get this reported to us. So we worked it out with the DOH, state DOH, and everyone else. But again, we still say to the families, sorry for your loss, and that our prayers and thoughts are with you and through these difficult times, because like I said before, this is a hard time to lose somebody, especially in this time with the coronavirus going on, and how do you deal with it, and you can't properly say goodbye. So to the 3 families from yesterday, we are so sorry for your loss from early this month, back I think it was May 3rd. But again, it's never easy for anybody. As of today, we have 1,619 positive cases, 907 people under mandatory quarantine. That's up 1 from yesterday. We have 3 people under precautionary quarantine. That's down 2 from yesterday, and it's an increase of 41 positive cases from yesterday. So 4,101 people have completed quarantine, and of those, 1,064 tested positive for the virus have recovered. So that's a recovery of 21 people recovered since yesterday who had the virus. There are now 27 people hospitalized with a hospitalization rate of 1.66% of those who have tested positive. That's up 2 from yesterday, the people hospitalized. It was at 25 yesterday, it's at 27 today. And our rate, the rate of hospitalization went up a little bit, 1.66. Yesterday it was at 1.58. We have 1 person still currently in the ICU. It's the same number as yesterday. And, So again, like I've said this before, with the aggressive testing that we've been doing going forward and continue to do out in the community, that's not going away. These numbers are going to shift. And the thing we're watching is just not the positive numbers that come back, is the hospitalization rate of how many people are going into the hospital, because that affects our matrix, and I'll get into that in a minute. But I do want to remind people our mobile testing sites are out there, so please call our number, area code 518-465-4771. 465-4771. For testing of essential employees also, continue to call Albany, and you can call that number at 1-888-364-3065, or you can go online. You can do the drive-through through the Colony Test site at riteaid.com, as always. And as always, Priority 1 Urgent Care in Gilderland, you can call there for appointment for both tests. So we will continue to be aggressive. We will be continuing for the next foreseeable future of continuing testing the community. We need your help. We need people to go get tested, especially essential workers. And when we get to phase 2, June 3rd, non-essential workers will start to get tested more. So, and things are going to change when you come out. So we've made that known to everyone. Yesterday, I showed you some slides about what businesses have to do to reopen. The essential businesses that have been open also need to comply with the reopening safety plan and New York State Department of Health documents, which we showed you yesterday, which they need to do. You need to keep a copy of both in your respective businesses, even though the ones that you submit to the state. So if someone comes in and checks on that, you got to have both documents for availability for inspections. You can print that stuff out online after you're done, pretty simple. As I said yesterday, both the safety plan template and the other documents are on the state's New York Forward page. You can just go New York Forward page, it's going to bring it to you, or you can hit the New York State Business Reopening Safety Plan template, and it will open it up that way. A couple of things that we talked about at the regional control room about businesses, compliance, and enforcement. It's been a question everyone keeps bringing up to us. And basically what we've gotten out of that conversation is, look, it's going to be up to the people. It's going to be up to the people that establish these businesses. It's going to be up to the workers to let them know if something's not being done correctly. And there's the numbers that you can call in, which I'll bring up in 1 second. So you'll be able to bring up the application. There's a New York State Pause Enforcement Task Force violation form that you can get. You can go online, and this form will you can fill it out and submit it so that they'll know there's a place not complying with the rules and regs, or if you feel unsafe. So please, by all means, take the time and do this if you have an issue. The other thing is that, as always, you can call the hotline number, and it's 1-833-789-0470. I had a bunch of people reach out about what number they can call. So there's a toll-free number you can call. There's a way to go online and make a complaint, so you can do it both ways. And again, we're going to do this together in a partnership. We're going to get through this together, working together, and by doing the right thing. And then employees who believe an employer is not doing the right thing, there's a form for them too to fill out. So if you work for somebody and you feel that your safety is in jeopardy, you feel that they're not doing the right thing, there's also a way that you can make a formal complaint. And but we do say, look, if you got a union contract, follow that. If you have procedures, follow that in your company first and foremost, and then go to this as a last resort. And I can assure you, all the businesses that I've talked to, they're well ahead of this. They've been planning for this. The ones that have been open have been doing this, implementing different things. Not all of them. So these are things that we need to continue to work together as we go forward, and we'll get through this together, working together. The compliance is really largely up to the people. Listen, I know the nice weather's here. I drove home and I saw about 50 kids playing soccer in Lincoln Park, and then I get down Hackett and I see a bunch of families walking around. We want you to get out, but there's still only no more than 10 people in a group. And you should have masks on. Everyone should have a mask on and still keeping social distance. So we're going to get through this. And here's my mandate to you. We'll get through this if we work together and you do the right thing. You're setting the tone whether or not we go to phase 2. So, that's going to be based on the numbers. And if the hospitalization rate continues to go up, if we start to break the matrix because we're getting more and more people coming back positive and not doing the right thing, then we'll never get to phase 2. And we will not have non-essential workers come back and restaurants start to open up by phase 3 if the people watching this and listening to this don't do what's right. And we want you to. We want you to go out, but we need you to continue to social distance. We need you to continue to wear your face mask and clean your hands and do the right stuff. And we'll get through this together, but only if we do this together. Dr. Whalen.
Good morning. So the bulk of the positive cases that we continue to see are from the nursing homes. As we've spoken to all of you about over the past couple of weeks, we have worked with the state and all our local nursing homes to ensure that every resident has been tested. We are at the tail end of that very large sampling, and the bulk of the cases that we're getting represent people that are coming back positive. We continue to work with the state and the nursing homes to ensure that there is testing twice weekly of all workers in nursing homes. I wanted to also mention that in the governor's briefing yesterday, he talked a lot about contact tracing. And this is something, as all of you know, we've been doing at the health department from day one. The state is rolling out a large database that Albany County will go live with on June 2nd. What I wanted to mention to people was that the governor specifically said if you get a call from a number that says, and I may be wrong with what it said something like New York State contact tracing, you should pick it up. What I want to let you know is in Albany County, you will still be called at this point from the health department. So because you get a call from the health department that does not say on your caller ID contact tracing, it doesn't mean that it's not an appropriate call. We still have all of that work in-house. In Albany County, we continue to do all of that reaching out through the health department, and that should be the number that you see. You should be speaking to somebody directly within the health department. I wanted to also mention additional guidance that came out from the governor, which was a good point and something that we've brought up a couple of times in the past few months on in these press conferences around general medical care. And this in particular was around pediatric vaccinations and the fact that during the last few months, understandably, people have not had a lot of their normal preventive visits. And this has particularly been noticed in the database that monitors pediatric immunizations. Last year, we did have a very big, substantial change in the mandate for pediatric immunizations to go to school. It's very important that parents start to look at that and see if your kids are up to date. It's important for school districts to start looking at that now in preparation for possible resumption of activities in the fall. So please reach out to your pediatrician if your child is due for a vaccination. We at the County Health Department do provide pediatric vaccinations, and we are able to provide those services if needed, so please don't hesitate to reach out to us on that. Thank you.
Thank you, Dr. Whalen, as always. And just want to make sure I said this right. It's been a long 72 days, and this is the 11th week. But there was one man in the 60s and 2 women in their 80s, so I just want to clarify that. So sorry about that. One of the other things they talked about in the control room with the enforcement was, do they get a parent's ticket? Do they get arrested? Is it a violation? A lot of great questions came up. And one of the things is there will be like violations written. And what could happen is it can end up in your business shutting down. And we don't want to do that. We want to continue to open up, continue to get our economy going, but to make sure that we do it in a way that protects the residents' safety and health first and foremost. That's what I'm worried about, and then the economy. And we'll get through this together by doing this together, and that's the only way it's going to get done, by all of you out there doing the right stuff when you go out this weekend. We got a letter from a resident that left Shaker Place. It was a really nice written letter to the staff saying thank you for everything, and I thought it was important to bring up because my workers out there are doing a great job, and they take the loss of somebody harder than probably some of the family because they've become so close to them. And they are working hard, and they are proud that they got through that last inspection with all stars, and the fact that they're doing everything in their power to make people comfortable in their final moments and be there for them, not just for the resident, but for the families and calling them. So I thought it'd be neat to share that letter. Also, we had, I want to say this right, we had Paul and his team from the Broad Street Bagel Company in Kinderhook who stopped by to deliver bagels to us. They came up to give bagels to all essential workers throughout our building and other places. Thank you for taking the time out of their day and coming up here. And I have to assure you the bagel was very delicious, so I say thank you for that. But the one thing I want to remind people about this weekend, it's the start of Memorial Day weekend, right? It's a long weekend. I'd say usually it's a longer weekend because everyone's off on Monday, but in this case, everyone's been pretty much off and at home. But it's a time that we reflect back on the ultimate price of freedom and the price that soldiers have paid defending us in multiple wars and conflicts over the years. And it's a time to remember them veterans. I know a lot of people like to have barbecues. They like to come together. I usually meet some military buddies, and we quietly every year get together to remember our brothers and sisters that we lost. In this case, we got to do it a little bit differently, and I'm saying please have respect for this weekend, for the people that laid their lives on the line. Think about them soldiers, pray for them, and remember, freedom isn't free. And I know a lot of people feel like their freedoms are taken away because they're sitting at home and being told they can't go out and they can't do this, they can't do that. I can assure you, the governor, myself, no one takes any no one takes any pride in sitting there or solace to sit there and go, I want you to stay home. But we want to protect the people of our constituents in Albany County and the Capital District. And the only way we can do that is we're fighting something no one's ever dealt with before. And we're fighting with something that we've never had to deal with before, and we're adjusting to it. And just like with the new thing that's happened with these children, it's affecting them differently. And decisions are being made on daycares and camps now because of the way it's affecting children. Again, something that we've never had to deal with before. And again, we'll get through this together. But as you reflect on this weekend and you want to have them barbecues and get together, remember, it's about the soldier that did the ultimate sacrifice for this country. So if you want to do them a favor, stay home, celebrate, say a prayer for them, and do the right thing, because it is up to you whether or not we continue to stay open. It's up to you whether or not we make it to phase 2 to get to phase 4. It's up to the people out there, because if you come out and I keep hearing from so many people, I'm done with this, I had enough, I'm over this. It hasn't gone away. If you listen to Dr. Whalen and myself, it's still there, and it's going to continue to be there. So we need your help to do the right stuff. We want you to go out, have your mask in public, clean your hands, and do the right thing. And please, if anything, take a moment and reflect on the soldiers that gave us these freedoms, that sacrificed the ultimate for this country. So again, thank you to everyone out there.